History and trends in surgery. The word surgery comes from the French word, but that too comes from the Latin chirurgia. In Greek word, chief meaning hand and ergon meaning work. So it's a kind of hand work. Father of surgery is Susruta. The father of modern surgery is Ambrose Pare. In ancient history, there were abdominal operations, surgical procedures for removal of vesicle, calculi, anal fistula, fractures, a repair of hernia, excision of tumors, trephination of skull, plastic surgery. In olden days, when people did mistakes, the ears and nose were cut. So Susruta made a new nose or ear for them. The repair of nose is known as rhinoplasty. Several types of knives and needles used to make incisions on the abdomen by using pumpkin as demonstration purposes. The suture material were the heads and the pincers of the black ants. You can see in the picture. Surgery in the late 20th century. Transplantation, lithotripsy, balloon dilatation, stent insertion. And you can see the scheduled surgeries, emergency surgeries. Trends in surgical nursing. Those were population trends, advanced nursing practice, healthcare reforms, computerization, knowledge expansion, evidence-based practice, consumer orientation, ethical concern, change in role of medical surgical nurse and caregivers, educator, advocator, leader and manager, as a change agent and as a researcher. Inflammation and abscess. Inflammation is an immune response that occurs after infection or injury. There are 3 types: acute, chronic and subacute. These are the causes and this is the process. Vascular permeability followed by exudation, vascular stasis. And the status, you can see the tissue injury. There is release of chemical responsible for the erythema and the non-pitting edema. There is leukocyte migration. Systemic and local signs of inflammation: redness, warmth, swelling, pus, pain, loss of function, fever. The treatment: with NSAIDs, corticosteroids, antihistamines, hot applications, cold applications. Infection is an invasion of the body by pathogens or microorganisms capable of producing the disease. The difference between inflammation and infection is that inflammation is an immune response to injury or infection. So inflammation is covered up in the infection process. This is a chain of infection. Course of infection: incubation period, prodromal stage, illness stage, and the convalescent stage. Incubation period is a period between the entrance of the pathogen into the body and appearance of first symptoms. In the prodromal stage, specific symptoms are not present. But when you come to the illness stage, the client manifests signs and symptoms of the specific signs and symptoms. Convalescent stage. Here, symptoms of an acute infection disappears, but the length of recovery depends on the severity of infection and the client's immune state. Thank you.